The NHS has been given the go-ahead to prescribe the first nightly pill for chronic insomnia. 1 in 3 people suffers from occasional insomnia. Around 7% suffer from chronic sleep problems. Marie Leconte is a journalist who's been dealing with insomnia for much of her life.
It's a bit like trying to describe what it's like to eat 3 meals a day, because I've always had it. So even as a baby and a child, I was an insomniac. So I guess what that means in practice is that I don't think once in my life I've ever been able to just go to bed and fall asleep. That's just not a thing I do. It's a process that usually takes anything from at best about an hour to sort of 3 or 4 hours when it gets really bad. And I also occasionally wake up several times in the middle of the night. In short, it's just that sleep is something that has never come easily to me ever.
The new medication, taken half an hour before bedtime, has been shown in trials to help people get to sleep more quickly and stay asleep for longer. And the National Institute of Health and Care Excellence has approved the drug, whose name I have no idea how to pronounce, but I think it's daridorexant, for those who suffer in the long term, who are unable to access talking therapies or find such methods don't help. Dr. Lindsay Browning is a psychologist, neuroscientist and author who holds a doctorate in insomnia from the University of Oxford. She's on the line now. Good afternoon.
Good afternoon.
How much of a breakthrough is it to have something to actually offer to people with chronic insomnia?
Well, this is a fantastic move forward, because the reality is we want to treat insomnia, the cause of it, in a behavioural sort of psychological way. We want to get people to be able to sleep without needing to rely on medication. However, for some people, they need a bit of extra help. And until this point, the medications available have been Z drugs, which like Zopiclone, Zolpidem, which people can only prescribe for a very short amount of time because we become tolerant to them so quickly, or antidepressants, benzodiazepines, all of these things which should only be used in the very short term, whereas this drug affects sleep in a very different way. So that's why it makes it so different. The other drugs tend to make you feel sleepy, so they increase your sleepiness, which can often result in a hangover effect the next day. You'll take a sleeping pill, you might sleep okay that night, but the next day when you're up and about, you might still have this sort of grogginess during the day, which is really unhelpful. Whereas this drug works in a completely different way. It blocks the action of 2 types of chemicals in our body which help us stay awake. So it basically stops our body from staying awake rather than making us extra sleepy. I know they kind of sound similar, but it's a very different action in the body, meaning that we can take this for a longer amount of time, and it's got less side effects. So it's a really great breakthrough, but it's not the number one option that we should be giving people when they're not sleeping well, but it's a great thing to have in that toolbox to be able to help people with.
And how important is it to treat insomnia? I mean, will these pills be worth the money?
Yeah, absolutely. Because there's been some talk about how expensive these pills are. They're something like £1.42 per tablet, which is a lot every single day, £1.42. However, when someone isn't sleeping well, when they have insomnia and they have chronic sleep problems, the associated sort of health implications with that are huge. You have increased risk of heart attack, stroke, diabetes, obesity, dementia, cancer, as well as a significantly increased risk of suicide. So if you imagine, what are the NHS sort of costs associated with treating those illnesses? And they're huge, let alone, you can't put a price on someone's life if the worst should happen and they were chronically had insomnia and depression and took their own life. So £1.42 actually isn't, when you look at it like that, I don't think is horrendous. But of course, what we really want to do is to fix insomnia so that people don't need to be on this medication long term. It's a little bit like antidepressants. If someone is really sad and low, then antidepressants can help, but they don't solve why that person is very low, has very low mood. And actually talking therapies is going to fix that and give them tools to be able to cope with the low mood or move beyond it. But sometimes you need antidepressants and talking therapy at the same time. And this is where this drug is kind of a complement to the talking therapy aspect of treating insomnia.
Dr. Lindsay Browning, thank you for that.